Isolation, the opposite of what those struggling with addiction and substance abuse need. While the Arizona Department of Health Services tracks COVID-19 numbers by the day, they also report the number of drug overdoses. In March, during the state shutdown because of the pandemic, at least 473 people died from overdoses in just 1 month. That's a nearly 40% increase compared to last year. So how has treatment changed to help, and how can we reach those who are struggling? Here's the Rebound's Megan Thompson.
Before a global pandemic, this epidemic was what captured Arizona headlines: opioid use, the crisis that was killing so many.
We got a lot of people into the opiate treatment plans and programs, but then of course this happens.
University of Arizona's Todd Vanderah is the chair of the pharmacology department, remembering back in 2017, 2018, when the use of opioids in the state peaked. His concern now, relapse.
Did that surprise you that we saw this spike, or did it sadly make sense?
It sadly makes sense in the fact that when people are depressed in general, or when they socially isolate, or when they think there's like sort of just general despair, like I may lose my job, unemployment's going on, the world's like, falling apart, that people sort of tend and trend to go towards substances of misuse.
He believes many of those struggling may be afraid to get help because of the virus.
Opiates naturally suppress our normal drive of breathing, and of course that's how people overdose. Well, that on top of COVID, in which it affects the lungs and your respiratory system and cardiovascular, so there's a big synergy between the two.
Christina Orleana, a primary therapist with the Scottsdale Recovery Center, where they have moved many of their services to Zoom.
In addition to the group work virtually, there's also individual sessions with therapists that we offer.
It's even allowed them to branch out, offering educational workshops for the whole family, so you can better understand how to support a loved one.
To give structure in an unstructured world is a huge, huge part of this and what we offer here. And I think that teaching patients about acceptance over the things outside of their control too is a really big thing to learn in recovery, but especially in society as it is right now.
If you know someone who is suffering from substance abuse, listen to their struggles. Let them talk and express what they're going through. Then be ready to take action with them.
Okay, this is what we're going to do next. We're going to contact a treatment center. We're going to look to see what meetings are available online. We're going to talk to this person in recovery who would be able to be of support to you, but just making sure that there's a plan in place.
A plan to prevent the numbers from climbing when we know each statistic is a human life that we should not have to lose. Megan Thompson, ABC 15, Arizona.
Online now at abc15.com/rebound, a list of resources for you or someone you know if they need to get help. Just click on this story to get started.